If you suffer from any type of orofacial pain like TMJ or migraine headaches, seeing a specialized dentist can help. Dr. Stan Farrell is a board-certified orofacial pain specialist, and he's here to tell us more about this. And you were saying earlier, Dr. Farrell, it's fairly new, this whole world of orofacial procedures that you're talking about.
It's a new area in medicine and dentistry, and actually what it does is it fills in the gap between dentistry and medicine, because for many years there's areas of pain and treatment of pain that have gone unnoticed for quite some time, and there's a significant link there, and that's why there's the new programs and training in this area called orofacial pain.
Gotcha, and that includes TMJ that we mentioned. Migraine headaches.
Migraine headaches.
Anything else?
Facial pain, different disorders, neurological, muscular disorders of the head and neck.
Wow.
On the face. And other things that cause pain.
And it's all related then to your teeth or to your mouth?
No, actually, it's a misconception. I mean, what dentistry has been kind of purveying, because for the most part, treatment of TMJ and things of this nature have fallen in the laps of dentists. And what they know best is teeth. So the medical part of it has been missed for many years.
I see.
Okay. So now we see that, for example, the TMJ issue and headaches, that most of it is medical. It's about 80% medical, 20% dental. But you need to be able to appreciate both sides of it. So if you don't have all the information, it's really hard to treat. And
that's why there's probably been so many people who can't get any relief, because the dentist knows the teeth, the medical doctor knows that, but nobody knows the two
the connection
combined.
between the two.
I see.
Exactly.
Now, what did you bring here?
Okay. These are splints. So if somebody has a TMJ problem that is maybe contributing to migraines or just pain and they can't eat or function, these are one of the things that we use as far as the treatment. It's a part of the treatment, and it basically takes the pressure off their joints and the muscles so they can relax and get better. The one on this frame right here, the clear one right here, is the standard type of splint that you've seen. And the new one right here is one that I've created. It's, of course, called the Farrell splint. And the difference you can tell is it looks like teeth, okay? And you can eat with it. So the difference with that is for patients that are self-conscious and they don't want people to know they're wearing a splint, they have one that looks like teeth.
Wow.
So you can't tell somebody's wearing it. And they can also eat with it.
Does it go right over their teeth?
It goes right over the teeth.
And that's TMJ is this jaw issue, right? That
that's
people
correct.
have? Okay.
That's correct.
I'm not that familiar with it, actually, but there's a lot of people who suffer from it.
Oh, yeah.
Does that lead to the migraine headache, or are they separate?
It does. Matter of fact,
we have a picture that we want to show.
Yeah, let's go ahead and let's take a look at the picture. Okay, good. Okay. Any pain in the head or the neck, okay, those pain fibers travel through an area in the brainstem called the trigeminal nucleus caudalis, and that we can see up here. And that's the area where migraines are triggered. So if we can control the information or the signals going into that area via, either sinus pain or TMJ pain or muscle spasms or toothaches, if we can control that, it's going to fire less migraines. Okay?
Interesting. So all these people have been suffering for all these years. They have tried all these sorts of things, and nothing has seemed to work. So you're kind of that
So it's basically figuring out what's triggering the migraines, eliminating that, and then usually the migraines start to go away.
Wow. So the goal for your patients, obviously they come to you in pain going, nothing seems to be working, and you kind of find that maybe that missing link.
Exactly. It's kind of like being a pain detective.
Right. Yeah. Right. Wow. So you can do that simply with these sort of stints, is that what you're calling them?
Yeah, splints.
Splints.
And it's only part of the treatment.
Okay.
So, if they have problems with the joints, it takes the pressure off the joints and also the muscles as well.
Wow.
Okay?
So
and if, and a lot of people are concerned about their bite being off, and maybe that's contributing, and what we've found through research as well is the bite usually isn't as much of a contribution to it, but by wearing these, you can pretty much instantly fix the bite.
Well, so what kind of success have you had with patients? Are they really finding that their migraine headaches have
been decreasing? Dramatic. It's a huge success.
And I'm assuming that they have tried everything else by now.
The typical patient that I see has seen 4 or 5 other doctors for their problem, and they just have gotten to the point where they're like, I'm just going to cope with it. And they walk around suffering with migraines, with pain problems, and that's it. So, but then when we get them in, we go through the process. I spend a lot of time with my patients initially to go through their history, the exam process, and then we figure out what these pain sources are, and get them on the right track.
Great relief for folks and a fairly easy fix, too.
Sure.
Wow, that's amazing. Thank you so much.
Oh, you're very welcome.
Kind of a brand new field that we haven't heard a lot about, so that's a good explanation. And if you do want to get more information, if you are a sufferer of TMJ or headaches, you can find Dr. Farrell very simply at azheadache.com, or you can go to aztmj.com, and there's the phone number right there on your screen, so give them a call and get better today. That would be great.